Very good afternoon to one and all. I'm Dr. RAKSHANDA, postgraduate from Karnool Medical College. Today I'll be presenting a rare paper on de Mauzière syndrome. Septo-optic dysplasia syndrome, a congenital disorder belonging to the midline brain malformations group, was firstly described in 1956 by the French neurologist Georges de Mauzière. Even though the phenotypic penetration can be highly variable, resulting in a wide heterogeneity, its classical triad includes optic nerve hypoplasia, agenesis of midline structures, namely the septum pellucidum and corpus callosum, and hypoplasia of the hypothalamo-pituitary axis. A 3-year-old female child came to the OPD with her mother complaining of inability to make eye contact, which was noticed since 5 months of age. She was the firstborn female child of non-consanguineous marriage. It was a full-term normal delivery. The baby cried immediately after birth with a birth weight of 3,000 grams. There is no history of alcohol intake, no history of any anti-epileptic drug intake by the mother in the antenatal period. Ocular examination, both eyes, anterior segment findings were normal, both eyes nystagmus was present, and the pupil in both eyes were round, regular, and sluggishly reacting to light. Post-dilatation fundoscopic examination, both eyes, the media was clear. A small hypoplastic optic disc was noted, which was normal in color, shape, and margins. The cup disc ratio was 0.3:1. Background retina was tessellated. Blood vessels were normal, and macula, a dull foveal reflex, is noted. Thus, a provisional diagnosis of both eye optic nerve hypoplasia was made. MRI brain showed a corpus callosal dysgenesis with severe thinning of the body, predominantly involving its mid and posterior segments, and mild thinning of the anterior segment. There is an absent superior portion of the interventricular septum. Small or hypoplastic pituitary gland with a diffuse thinning of the pituitary stalk was noted. There is a severe reduction in caliber of both the optic nerves with severe thinning of the optic chiasma, which is suggestive of optic nerve hypoplasia. Thus, a final diagnosis of de Mauzière syndrome or septo-optic dysplasia was made. Here we can see the MRI brain image where we can see the corpus callosal dysgenesis and thinning of the superior portion of the interventricular septum. The fundus image, we are able to see a hypoplastic optic disc, and the macula is more than 2 diopters from the optic disc. Discussion. Optic nerve hypoplasia is a non-progressive congenital disc anomaly characterized by a small optic disc with a double ring sign, which may result from excessive apoptosis of the retinal ganglion cells during visual pathway development. Visual acuity may range from a no light perception to normal vision. Associated features include nystagmus in 26 to 86%, strabismus in 42 to 52%, axial myopias, and astigmatism. Variable pituitary hypothalamic dysfunctions ranging from isolated deficit of the pituitary hormones to panhypopituitarism is commonly seen. The most prevalent findings on neuroimaging includes an absent septum pellucidum in 53%, corpus callosum hypoplasia, and abnormalities of the pituitary gland in 13 to 34%. Thus, septo-optic dysplasia is a rare, heterogeneous congenital disorder, and with this paper, we have attempted to increase the awareness regarding its red flag signs and early diagnosis. With adequate hormone replacement treatment and a thorough neuro-ophthalmologic follow-up can improve the overall prognosis of the patient. Unfortunately, it is not a curable disease, but its outcome can be optimized as above with adequate hormonal replacement, neurological follow-up, and a multidisciplinary support. These are my references.